We are just a few days into the new year and COVID cases are on the rise in our area. As of January 3rd, there are 52 patients in the hospital with COVID, 8 in the ICU, 2 on ventilators. Of course, this is within the UofL Health system. Before Christmas, that number was down. It was 41 patients in the hospital, 5 in the ICU, 2 on ventilators. So let's check in with UofL Health's Dr. Mark Burns. We know COVID is up right now, but let's talk about those other 2 illnesses, flu and RSV. What are you seeing with those?
Well, at this time, it would appear that we actually are peaking with flu and RSV. So, but unfortunately, with COVID, however, it's still rising.
Still rising. Okay, so whenever we hear rising COVID, you know that word, everybody brings up masks. What are you advising patients?
At this time, because we have just come off the holidays and we are expecting a spike, I personally would recommend people to wear a mask in situations where there are crowded, place where there may not be adequate ventilation, or if you're in a community where you have high spread, I definitely recommend wearing a mask.
And as we look ahead to that peak, when do you think we will hit it coming off of this holiday season?
Well, traditionally, if you look back for the past couple of years, usually about maybe February, toward the beginning of February, and then if you look at the way the curve goes, it usually kind of slides down after that. So we'll have the spike, peak, and then it should digress.
3rd year dealing with this, coming off the holidays, and another COVID increase. Is this just the new normal, you think?
It kind of appears that way because, again, as you mentioned, it is the 3rd year. We still advocate people getting vaccinated. That's going to be our best weapon against all this. But yes, it kind of appears that, unfortunately, for right now, may be the new normal.
And for anybody wondering about flu shot vaccines, is that still something that's worth it right now?
Absolutely. We are getting vaccinated against the flu. There's plenty of vaccine available, and people should continue to do that. You can also get your COVID vaccine, the new bivalent vaccine, at the same time that you get your flu vaccine if you want.
And is that something you're seeing is working pretty well?
Yes, it is actually working fairly well, yes.
Excellent. All right, Dr. Burns, we will always enjoy having you on with us here on the 4 o'clock news. Thank you so much for coming on this week. And you heard them, folks, vaccination still the key to keeping yourself healthy this time of year.